Restart a Heart Day. Every year, October 16th, globally is considered as World Restart a Heart Day. On this day, globally, to create awareness on cardiac arrest and cardiopulmonary resuscitation throughout the world, October 16th is observed as a World Restart a Heart Day. Now, on behalf of Srinivas Heart Foundation and Srinivas Heart Center, for the last more than 15 years, we have been conducting training sessions on lay rescue or CPR, particularly for the lay public. Cardiac arrest is an important public health problem throughout the world. Worldwide, the survival rate of out-of-hospital cardiac arrest, that is, cardiac arrest which occurs in residence, apartment buildings, public places like railway station, airport, malls, on the road, on travel, the survival rate is still far less than 10%. To improve the survival rate of out-of-hospital cardiac arrest subject, we need to create increased awareness on cardiac arrest and CPR among lay public, particularly in India. Sudden cardiac arrest is a situation where the person collapses suddenly. There's no breathing, there's no pulse. Prior symptoms like chest pain, breathlessness, palpitations may be there or may not be there. What is the common cause for a cardiac arrest? The most common cause for a cardiac arrest is an acute myocardial infarction in medical terminology or a heart attack. What is the difference between a heart attack and sudden cardiac arrest? Are they the same? Now, 50% of patients with heart attack are likely to have sudden cardiac arrest. In situations of heart attack, and within few minutes, the heart muscle starts dying, what is called in medical terms as a heart attack or an acute myocardial infarction. In such situations, in a particular percentage of patients, suddenly the normal heart rate and rhythm becomes dangerously irregular. In medical terms, what we call as a ventricular tachycardia or ventricular fibrillation, and the cardiac arrest occurs. In such situations, there is a circulatory arrest, there's no pulse, and then the first organ to be affected is the brain. In such situations, suddenly the person collapses and loses consciousness. Within 4 to 8 minutes, if there is no attempt to revive the subject of cardiac arrest, the survival rate would be very poor. Within 10 seconds, hands-only CPR has to be started after recognizing cardiac arrest, and then there is an attempt to save the person. But if there is a delay in performing high-quality CPR or usage of an automated external defibrillator, if available, then the survival rate would be very poor because brain death occurs after 8 to 10 minutes. This, in medical terms, is what is called as the chain of survival concept internationally. When someone collapses suddenly, we have to recognize cardiac arrest and call the emergency ambulance system immediately. There's a first step. The second step is performing high-quality chest compressions. Recognize cardiac arrest, call the ambulance, place the heel of the hand over the center of the chest, lock it with the other hand, and perform high-quality chest compressions or hands-only CPR or bystander CPR. 100 to 120 times a minute, pushing hard and fast without any interruption, and then continue the hands-only CPR or bystander CPR until the ambulance arrives on scene or the person is revived. If an AED is available, at the third step, get the AED on scene, automated external defibrillator, and as per the voice prompts given by the automated external defibrillator, perform usage of an AED. The fourth step is, while the person is doing hands-only CPR or usage of an AED if available, the fourth step is arrival of the ambulance, and the paramedics will take over and give further life support and then shift the subject of cardiac arrest to a ICCU care or a post-cardiac arrest care, shifting to the hospital. That is the fourth step. And in the hospital, delivering evidence-based treatment as per international guidelines, what you call as a post-cardiac arrest care, is the fifth step. And if all these steps are performed systematically and correctly, recognizing cardiac arrest, calling the ambulance, performing high-quality CPR, Third one is usage of an automated external defibrillator if available, and arrival of an ambulance early within 4 to 5 minutes, and then shifting the subject to post cardiac arrest care, giving post cardiac arrest care. Then the sixth one, the subject will be revived in a fully recovered position. These six principles are called as the chain of survival concept as per international guidelines.